half of the population. Around 4.5 billion people are not fully covered by essential health services. The urgency for leadership, innovation, and partnership has never been greater. African countries, Japan, the public and private sector partners, and the United Nations are leading the way. This is why it is so important that we are meeting here today at the TICAD 9.
Climate change and its impacts are altering disease patterns and disrupting health services. It is threatening crucial progress on TB, malaria, and neglected tropical diseases. There is also a growing risk of pandemics, which could be as high as 3 times greater in the coming decades. Official development assistance in Africa's health sector fell by a staggering 70% between 2021 and 2025. So 2/3 of African countries are spending more on debt servicing than on health care. The future of health security in Africa requires more than reacting to the challenges. We must proactively unlock opportunities to build a healthier and more resilient future for all.
How can we, as individuals, in terms of our individual mandates, expertise and experience, but more importantly, how can we best work with each other?
So what we did with this program was to use AI to help us leapfrog the barrier of not having enough data. We don't have biobanks in Africa, and use a technique we call transfer learning to identify genetic variants using artificial intelligence that are prevalent in Africa that are likely to affect the breakdown or metabolism of malaria and TB drugs, and then incorporate the effects of these genetic variants into existing mathematical models to predict what doses must be used in people carrying certain genetic mutations.
1.5 million children dead because of missed vaccination or mismanagement of the vaccination. The reason why we decided to develop this child fingerprint identification system. So together with Gavi, we went to Bangladesh for the POC, proof of concept. We made many testing, field test, operational test, technical test. After 2 years, finally we set up such a one digitalized vaccination systems.
Access should not be an afterthought. I'd like to mention that you have to consider about access early in the phase. In 2019, we established this platform uniting efforts for innovation technology, scientific technology, with collaboration with UNDP, and that it gives a platform for innovators, funders, access stakeholders to all come together and share the problem that they have, so that you can easily plan for the future.
If I am a manufacturer, I have to think about navigating 55 different regulatory requirements to get my product to the population that need it. We need to work on our regulatory systems. We need to ensure that they are harmonized. If a manufacturer, if a developer wants to penetrate the African continent, they don't have to navigate the 55. They have to have one reference regulatory decision at the continental level. That is why we had started the African Medicines Regulatory Harmonization Initiative. And as we speak today, the African Medicines Agency is being established, building on this process that we started as a continent.
Collaboration in technology development, financing, and strong partnerships in the health sector will be a driving force for the future. The government of Japan will firmly stand by and actively promote these efforts.